Hi, my name is Dr. Zak of Dr. Zak Dental Care, and today what I'd like to talk to you about is the three main reasons why dentures are a temporary solution versus a permanent one. I would like to share my deepest insight as a dental professional and explain to you how that works. The number one reason that's a problem that I see with dentures constantly is the plastic feel and the prosthetic feel of the actual denture. When we place dentures into people's mouths, especially when they come from natural teeth, people complain about having a lot of plastic in their mouth. Let me just show you what I'm talking about. If you look, this is an upper, what we call a maxillary denture, and if you look, it covers a lot of surface area. So essentially this is covering your entire palate. And this changes the way you taste food, the way you perceive taste and swallow. And some people have gag reactions, and it isn't a very easy thing to get used to. However, the upper denture, because of the surface area, does have better suction capability than a lower denture. The lower denture, on the other hand, is much more narrow, but also has a tendency not to be as retentive. And you could see here, it doesn't have the palatal area. It allows area for the tongue to get in, but on the other hand, it flops around more, is not as stable. So what most people end up doing because of the stability issue is they use paste. So you have to kind of line the denture with a little bit of paste and stick it in, and it suctions, and every couple hours you have to add more paste to be able to function with it. That's the number one problem. The number two problem is functionality. And I kind of touched on it initially. Chewing with these is not the easiest thing to do. You have to get used to them. You have to use paste. They're pretty much good for cosmetics, but when you start eating and chewing and functioning, they, in most instances, don't work very well, and people who have dentures end up chewing softer foods most of the time. And the number three reason, and which is a very important reason, that I think not a lot of people are aware of, is teeth themselves function as bone preservation devices, okay? If you extract your teeth, or if you lose all your teeth, what happens is the bone starts to shrink at a much more rapid pace in the jaw than when the teeth are present. And so what happens is, if initially people get dentures and they're fairly young, let's say they're in their 50s and they get full dentures and they don't have any roots inside their mouth, the bone starts to shrink very, very quickly. So 10 years from now, the bone levels will recede. So this is a situation where this person lost all of their teeth. This is what we call a panoramic X-ray. And this person lost all of their teeth. So at this point, there's quite a bit of bone that you could see on the X-ray. As the person starts to function and all the forces that are rendered during chewing, this bone will start to shrink rather quickly. And if you lose bone, you ultimately will lose retention in the denture as well, and the functionality will get worse and worse and worse. So these are the three main reasons that dentures are really more of a temporary solution versus a permanent one. So thanks very much for watching. If you have any further questions or have more interest in finding out about it, please don't hesitate to call us, schedule an appointment. My name is Dr. Zak of Zak Dental. Bye-bye.